Hello, my health savvy friends. It's Dr. Tom Micklewright here. Today, talking about how to stop a cough that just won't go away. At any one point in time, 1 in 8 people have a cough, and you've probably had the experience of having a lingering, hacking cough clearing your throat. And you maybe remember having a cold or flu 4-5 weeks ago, but you can't figure out why you just can't clear this cough. During the COVID-19 pandemic, we saw more people than ever with a cough before, and more people with a cough that lingered, sometimes for up to 3 or 6 months after they had an infection. This undermined all of our confidence around what a normal cough looks like. And trust me, as someone who had my 3rd bout of COVID-19 just a week ago, I feel your pain. Coughing is a pain in the butt. Yet, there's loads you can do. And the key thing is knowing where you are in that journey, managing some of the common stuff yourself, and knowing when to get help. So let's start with a typical cough journey. Between weeks 0 and 3, the most common cause of a cough is a viral infection. But if you're having a temperature over 38 degrees C or 100 degrees Fahrenheit, or you're getting any chest pain, coughing up blood, or difficulty breathing, those are warning signs, and they indicate that you definitely need to see a physician or a doctor to get yourself checked. Between 3 and 8 weeks, the usual cause is a post-infective cough. So this is your lungs just calming down after that kind of sudden acute infection that you had. Generally, the signs are the same as for 0 to 3 weeks. So shortness of breath, chest pain, high temperature, and coughing up any blood. Once you get past 8 weeks though, we start looking at some of the more unusual causes of a prolonged cough. These might include, for instance, asthma or COPD or emphysema. It might include some medications, and blood pressure medications like ramipril or enalapril are typical culprits here. Or it could even be due to smoking. The 2 biggies that we often see though are gastroesophageal reflux or acid reflux, and post-nasal drip or PND. In gastroesophageal reflux, what's happening is the acid from the stomach is washing up the food pipe and just burning the back of the throat and the vocal cords, causing that prolonged cough. This might be especially so if you've got a cough that's worse just after eating or when you're lying down in bed at night. In post-nasal drip, the problem is that mucus is dripping down the back of the nose, drip, drip, drip to the back of the throat and the vocal cords, again causing irritation. So if you've got a prolonged cough, and you're finding yourself constantly clearing your throat or blowing your nose, you're feeling very congested, it could be post-nasal drip. So how do you actually stop some of these things? Well, I think there are 5 things you can start doing today which might help. The first is if you can recall having a viral infection, so a cold or flu in the last 6 weeks, I would say you can, to an extent, relax. This might just be a post-infective cough that needs a little bit more longer to settle down. If you're a smoker, you might want to try knocking that on the head for the few weeks and see what that does to your cough. Number 3, if you think it might be acid reflux, so you're already prone to heartburn or you're getting the cough typically with eating or when lying down, try cutting out caffeine and alcohol for a few weeks. Those are typical triggers for heartburn. And also try taking some Gaviscon at night just before you go to bed. This will help suppress your stomach acid so that when you're lying in bed at night, it's less prone to wash up your food pipe and damage the back of the throat. Number 4, if you think you might have post-nasal drip, so you're feeling a bit bunged up and congested, or you're constantly clearing your throat, you can feel that ball of mucus there, you can try purchasing an over-the-counter steroid nasal spray. You don't need a prescription for these. But if you start using that on a daily basis, you may well find that after 2 or 3 weeks, you're noticing a difference in the quality of your cough, and that indicates it could well be due to post-nasal drip. And number 5, keep a symptom diary. I know it sounds really obvious, but if you can just keep a record of when you're getting your cough, what the triggers seem to be, what makes it better, what makes it worse, that information is invaluable. Because if you have to go to a doctor or nurse later, they'll be able to use that information to determine whether it could be one of those other causes like COPD or asthma or some rarer causes of prolonged coughing. Super important though is knowing when to get help. We've already talked about some of the red flag signs like chest pain, coughing up blood, difficulty breathing, fever. But I would say anytime you reach 8 weeks of a cough, you definitely should be getting a healthcare professional to take a look. That's because you might need specialist tests like a chest x-ray or tests to rule out asthma or COPD. This is especially important if you've got a history of smoking, because your risk of nastier conditions like lung cancer are that much higher. So definitely, once you hit 8 weeks, that's your prompt to go seek specialist help. Lastly, I did mention that some medications can cause a long-term cough. This is just a warning. Do not go changing any of your medications without speaking to your healthcare team. They'll be able to advise you on whether they think it's likely your medications are causing your cough. And they'll also be able to advise you on which ones you really need to stay on or where simple substitutions can be made. That's a wrap for today. Just to summarize then, when you've got a cough that won't go away, the most important things are know where on your journey you are, some of the simple things that you can do to stop your cough, and know when to get help. If you are someone that's also trying to stop smoking, I have done a separate video on health apps you can download that can really help with that. And similarly, if you're wondering if there's anything you can do to control your asthma better, similarly, there's another video on health apps to support patients with asthma. If you've got any comments though, feedback or questions, please post them in the comments below. I'm really trying to build a community around people who want to take a more active approach in controlling their health. So I'd love you to subscribe to the page, keep an eye out for other videos, and join in the online discussion. For now though, thank you very much for joining us and look forward to seeing you on the next video.